Hey everybody, this is Troy Nafsker and Dr. John Koch with Advanced Age Management in Medina. We're going to be kind of introducing this program and some of the new things coming up as we continue to grow. So first and foremost, if you're looking for information on us, you can go to www.lowtohio.com or you can contact us directly, 330-242-7669. I'm going to introduce our new radio show, which is going to be coming out. It's going to be called Well Adjusted. So this should be a lot of fun as we continue to adjust hormones and help men with their aging and continue to help folks age gracefully. So Dr. Koch is our medical director here, and I just want to get through a few questions and discuss a little bit about, you know, what is this program? What are we trying to achieve? What kind of symptoms might folks be having? And what's the first step here? So first, I'll just let Dr. Koch go on a little background on himself, kind of how he's gotten here and what we've decided to do with this.
Fair enough. Welcome everybody that's listening. I'm Dr. John Koch. I'm a medical doctor, originally trained in family practice and sports medicine, Fairview Hospital, Cleveland Clinic. So I'm a Cleveland resident and kind of grew up here and was educated here as well. I got interested in age management back in residency actually. Was following a doctor that was a geriatrician, and he was doing some testosterone with patients quite some time ago, probably was that back in 2000, 2001, 2002. So you know, that was a pretty early experience. Not as it wasn't as widespread and as popular as it is now, but I got to see some amazing results with the patients. Back then, they were coming in for an injection, whether it's once or twice a month, whenever they could get into the clinic. One of the things I noticed is everybody was happy for about the first week or week and a half. And by that second week, or unfortunately if they came in once a month, they felt like crap. And they just were fatigued, and they had joint aches, and their energy sucked, and their libido was down, and things like that. And they said, "Doc, I need that shot. I need it. I would need to feel good again." And that really struck a chord with me, because we're trying to make people feel better. I mean, all medicine is trying to, you know, we're trying to help people live better lives, try to, you know, help them with disease and keep them disease free, really. But really, it is about feeling better, functioning better, feeling younger. You know, not telling people, well, you know, you're 50 now, so you kind of got to, you know, do like your parents and grandparents and start gardening and start doing a bunch of stuff that we don't want to do. You know, we certainly, I don't want to hear that. I don't want to hear that. Do you want to hear that?
Absolutely not.
So I want to hear, you know, now that you're a little older, you know, we can take care of some of those symptoms that you're having and things that are, you know, going on that medically that are preventing you from doing what you want to do. You know, be it hiking or weightlifting or running or fishing, I mean, swimming, whatever you want to do. We don't want to tell patients no. We want to, you know, really have them to be able to do whatever makes their life fulfilling and fun. So that was my first introduction to testosterone replacement therapy, but I've always been interested in medical wellness, prevention, advanced medical nutrition, exercise physiology, things like that. You know, I have a background myself in a lot of sports, martial arts, natural bodybuilding, things like that. But so I sought out the American Academy of Anti-Aging, got their board certification, eventually became a medical questioner and examiner, board examiner for them, the Age Management Medical Group, and Senegenics Medical Institute. So I've worked for probably 6 or 7 different companies that do age management medicine in some capacity or the other. So I have a lot of experience, and Troy and I have been working together for what now? I mean, it's been
7 years.
Yeah. So quite some time. We share a very similar philosophy with our physical medicine practice in Medina, and also with age management medicine and prevention. You know, I hate seeing folks come in with a laundry list of medicines, and they go to see 1 million doctors, and they feel like SHIT. And so that's not living, and I don't want our patients to get that way. So we want to be proactive, and we want to address these things before they get the laundry list of medicines, before they have to see, you know, millions of doctors and, you know, go to the clinic or wherever else and just not feel good, and then experience not only those medical problems, but the side effects of all the drugs that they are really on. You know, we want to do things naturally. We want to have your body, you know, do what we can, but there's some things that we can't correct. We can't correct cellular aging on our own, and we can't correct hormones and metabolic deficiencies on our own without some help. And the help is what we provide. So that's a little bit of my background.
So for these guys listening out here today, as we get this program, and this thing has grown, you know, very, very large for us, and it's been a really, you know, huge success here in Medina. But if there's people out there listening, and there's men out there listening, who would you say is the ideal person that should really come in and get their hormones checked? And we'll talk about the, how that occurs here shortly. But who's the ideal person that you would say should come into this program to have a look and see what we can do to help?
Yeah, that's a great question. So really, we're kind of looking for people over the age of 35. Matter of fact, I used to say over 40, but we're actually catching quite a few folks earlier now that are 35 to 40 that have some hormone deficiencies.
Sure.
But common symptoms are being things like fatigue is a big one. Poor sleep can be another symptom. Just more aches and pains. The tolerance to exercise is a really, really large one, where people say, I'm not getting the results from exercise that I used to get. I'm doing the same thing, and I have more abdominal body fat, I have more torso body fat, my muscles aren't responding the same, I'm not quite as strong as I used to, I'm certainly not healing as well. So there's a lot of little injuries like joint aches and little tendonitis and things like that. So aches and pains, energy, body composition changes, sleep changes. Folks that may have a change in libido, maybe they had a higher sex drive when they were younger, and now they notice that it's slipping. There's less frequent morning erections. Maybe that's not quite as good as it used to be, or certainly at least the drive is not as good as it used to be. So those are some of the things that we tend to see. I think those are the candidates that we really want to see. I mean, I would say, when you got a 25-year-old that that has symptoms like this, it's not an age-related issue. This is something that they should consult their medical doctor and an endocrinologist about. But really, there's nobody better positioned for the middle-aged and older person, especially males, for hormone deficiency, because it kind of there's some overlap between endocrinology, from urology, and from family practice doctors. And honestly, the family practice doctors, as good as they are, they have to know a little bit about everything, and they don't specialize in any one area. And this is a specialty. To do this safely and appropriately, to monitor the correct labs, make sure people don't have side effects, make sure that they're functioning optimally, and really to navigate this cascade of complex hormones and messengers, they really need an expert. You need somebody that knows what they're doing, that has seen thousands of patients, or at least hundreds of patients before. I've seen a couple thousand through all these different entities, and I know you've seen hundreds of patients already, at least. And extremely bright, he's every bit as good as me, if not better. Anyways, so I just think that you need to see an expert, and you don't want to go to someone who tinkers around with this. It's not appropriate.
So a lot of folks, I'm glad that you mentioned this earlier, a lot of folks think that low testosterone just has to do with libido or sexual function. And would you say that's kind of a myth? Because I like that you mentioned the myriad of symptoms that someone out there may be listening and kind of hearing this and go, hey, listen, there's a lot of symptoms, but that's kind of a myth, would you say?
Yeah, I mean, there's an association, but there's many factors that play into libido and sex drive. I've seen folks with low testosterone that have higher than average libidos, and vice versa. Guys that come in and their testosterone and other hormones are great, but they just have very poor libidos. So it's an association, but it certainly isn't. It's not even the number one symptom that I would say. I honestly would say that the number 1 and 2 symptoms that are most common that I see are fatigue and body composition changes with lack of response to exercise.
I would agree, and that's the number one thing that we see. So step one, patients out there, there were prospective folks out there maybe listening or kind of hearing this, step one.
We got to screen you. We have to see you. We need to do some testing. We do some biomarker testing. We definitely want to do a very complex set of labs, very thorough, to see exactly what's going on. And these are not the labs that you would get at a general practice doctor. I mean, I was a general practice doctor, with sports medicine, and I know what we did, and I know what we got trained, and I know what we know. Troy and I have taken a special interest in this for years. Countless conferences and patients and such. So there's protocols that we want to follow, and certainly labs that we need to get to really dig down through the weeds and see what's going on with the patient. So as an example, sometimes people will go to their family doc and say, Doc, can I just have a testosterone? Oh, sure, we'll do it. And so they measure total testosterone, and that's all they measure. They don't measure binding globulins, they don't measure free testosterone, they don't measure estrogen, they don't measure anything else, and certainly no other hormones. And so they just give them their total testosterone. I can tell you for sure, I've seen many, many patients that have a normal total testosterone, and they have high binding globulins, they have sometimes high estrogen, and they have a very, very bad free testosterone. And they feel like garbage. They are definitely clinically testosterone deficient, although their total testosterone does not prove that.
Sure.
But the free does.
Yeah.
And they may have other associated lab abnormalities that can help quantify what's going on, certainly that we could catch.
So here's what we're doing through the month of December and January is if you go to our website, www.lowtohio.com, you'll see on there's a $35 hormone assessment on there. We're going to waive that for the next 2 months. So you can come in and we offer a free consultation, then we'll decide what to do. So the first step is essentially, let's just get you checked, okay? Yeah. Let's find out what's going on. Let's spend a good 45 minutes sitting down, kind of going through your health history, what's going on, and then make a decision on what to do. So our first step would be just reach out to us via that website, or you can contact us directly, 330-242-7669. And I like one thing that Dr. Koch touched on, which is some folks have seen their family doctors. One of the things we'll talk about next time is creams. And how many patients that we see come through on creams and they're just not getting the results they're looking for with these things. And we'll talk a little bit as to why next time. Stay tuned. You're going to see us really, really soon on 1100 a.m. and WMMS on our new show called Well Adjusted. We'll look forward to seeing you then. And any final thoughts?
I have a lot of extra thoughts, but let's save them for next time.
Great. We'll look forward to talking to you next time. And if you have questions, again, www.lowtohio.com.